While the patient is in standing, the examiner uses a small rigid ruler to first measure the distance from the most prominent part of the navicular tuberosity to the floor with the foot in normal relaxed standing. The height is then remeasured with the foot in the neutral talus position. A second reading is usually greater than the first reading. The difference is called the navicular drop and indicates the amount of foot pronation or flattening of the medial longitudinal arch that occurs during normal standing.